Alright, remember the Joe Namath ads during Medicare annual enrollment or open enrollment? Let's read this article called "The Troubled Insurance Sales Firm Behind Those Joe Namath Ads for Medicare Advantage." That's right, they're in big trouble. Benefit Technologies has been shaking off lawsuits and regulators for years. It's now peddling Medicare Advantage plans to seniors where if someone picks a subpar plan, the results can be disastrous. This is from Joanne Robin, a little bit dated earlier this December, but it's still good for beneficiaries to be very wary of those commercials that they see on TV or even in social media. The 2020 advertisement for the Medicare Advantage Plan hotline run by Together Health, a subsidiary of Benefit Technology, during his 2020 State of the Department speech, then Secretary of Health and Human Services Alexis Azar made a curious reference to his TV viewing habits. If you watch a lot of cable news, he said, you may have seen frequent communications and commercials talking about how Medicare beneficiaries can call a 1-800 number to inquire about whether they're eligible for new benefits. He continued, one particular ad looks a bit like something out of the 1990s with red, white, and blue graphics, and to complete the picture, there's an NFL star from the 1960s involved. The helpline may not look or sound like the future of healthcare, as Azar said, but he avowed that it represented real savings or real options for seniors. Just note, he is no longer the Secretary of Health and Human Services. See that? All right. The TV campaign, which first aired in 2018, stars 78-year-old Joe Namath for. Joe Namath is for the Medicare Coverage Helpline. With a crinkled smile, Joe Namath lists a handful of healthcare benefits from no copays to home-delivered meals, intended to attract callers on Medicare. The kitschy campaign reaches peak saturation each year during the annual enrollment period, with newer ads featuring Star Trek William Shatner and Jimmy Walker from The Good Times. The commercials pitch Medicare Advantage plans as an alternative to traditional Medicare, the popular public insurance program for seniors and certain people with disabilities. They offer extras such as dental, vision, hearing services, prescription drug coverage. In the first half of 2021, around 42% of the Medicare population, roughly 26 million out of 62.7 million Medicare beneficiaries, opted for Medicare Advantage, which also tend to have lower premiums. At first glance, Medicare Advantage seems like a savvy choice. And Namath doesn't specify that benefits vary by state and sometimes even by county. There are other pitfalls too. If you live in a rural area or become seriously ill, for example, you may not be able to access the medical services you need without paying out of pocket. Researchers have found that aside from the financial risk, choosing the wrong plan can literally knock off years off your life. Many Medicare Advantage plans are offered by big-name insurance companies such as Humana, United Healthcare, and Aetna, but others come from newer entrants to the increasingly cramped marketplace. In 2021, the average Medicare beneficiary had access to 33 options. Making decisions about Medicare can seem daunting, said Kathy Stokes, the Director of Fraud Prevention at AARP Fraud Watch Network, in an email. A lot of bad actors out there looking to take advantage of people's uncertainty. Be skeptical of ads, mailings, and emails offering discounted prescription drug plans or supplemental Medicare coverage. Whether Namath, whose long football career likely left him with Medicare subsidies, has any idea what he's hawking is unclear. He's not interested in talking about it, or so says his longtime agent Jim Walsh. I'm just a lawyer, Walsh said when he politely asked he wasn't in a position to chat about his client's contract. So who is behind the aging star-spangled hotline? Together Health, a Florida-based insurance marketing firm, and its parent company, Benefit Technologies, which is a far less clear-cut than its all-American spokesman. Benefit Evolution offers a dizzying tour through the world of insurance brokers, wading into consumer confusion to sell often subpar plans. Seniors are only one target. Oh goodness, so that means bait and switch. Okay, so in the summer of 2019, Gavin Southwell was in New York with some of his senior staff, having traveled from Tampa, Florida, where he's the CEO of a company that creates online platforms for selling insurance. Before it rebranded in 2020 to Benefit Technologies, the company was called Health Insurance Innovation, and the team was headed to NASDAQ Tower in Times Square to ring the opening bell of the trading week. Inside a glass-walled television studio on the ground floor, David Wick, a vice president at NASDAQ, called Southwell to the podium. Gavin, sometimes the louder of the group, claps and cheers, the more the stock goes up. Wick said, amid cheers from the besuited audience clapping along like a game show host. He congratulated the visiting CEO on his company's recent acquisition of Together Health. So the new subsidiary Medicare coverage helpline, established in 2017, would enable health insurance innovations to connect seniors with health insurers. Together Health's website currently claims to partner with the nation's leading Medicare carriers, including Humana and WellCare. Since its founding in 2008, Health Insurance Innovations had rapidly expanded its operations, providing online sales platforms for a huge network of third-party insurance brokers. Oh wow! Alongside its own direct-to-consumer operations. So, yeah, they did third-party as well as direct-to-consumer. Okay, so 2 books of business. Okay, for years, most of the brokers working under the company's umbrella sold health and life insurance products unrelated to Medicare. Oh my goodness. Unrelated to Medicare. And I'm just going to read a little bit more, y'all, but I'm going to link this below. So if for those smart Medicare consumers that actually do the research and want to stay on top of their Medicare benefits, this is one's for you. Okay, a little bit more. Particularly popular were short-term health insurance plans. Oh my goodness, that's terrible. A low-cost option for bridging brief gaps in coverage, because short-term health insurance plans are meant to be just that, short-term. They're exempt from the minimum coverage standards of the Affordable Care Act, a detail that brokers tended to downplay. Yeah, bait and switch. Terrible. That's what happens on the phones, especially at huge call centers. Okay, so when customers saddled with unpaid medical bills began to suspect a grift, the ambiguous legal arrangement caught the attention of the regulators. In time, even some investigators sued Health Insurance Innovations for shirking its compliance responsibilities, although the companies attempted to distance itself from the brokers, making the sales on a day-to-day basis. What these investigations and lawsuits turned up confirmed the complaints. Brokers had indeed failed to disclose the limited nature of coverage they were selling. Health Insurance Innovations model is very unique because there are many layers between them and the consumer, said Tyler Robbins, a former investigator in the Washington State Insurance Commissioner's Office, who was a part of the state's investigation into the company. There is nothing inherently sinister about the arrangement like that, but it does make it difficult when you can't draw a straight line. Okay, Washington was one of 43 states to probe the company's sales and marketing practices. Wow. Starting with 2016 and ending in a $3.3 $3.4 million multi-state settlement in which the company did not admit any wrongdoing. When the Obama administration tried to restrict the sale of short-term health insurance plans, Health Insurance Innovations share price plummeted to an all-time low of around $4. Just months later, though, a reprieve arrived in the form of Donald Trump with his election, and the company's stock rebound, jumping 166%. Excuse me. By the end of 2016. In February 2018, shortly after Azar took the reins at the Department of Health and Human Services, the new administration proposed to extend the maximum length of the plans previously capped at 3 months to 1 year, with the option to renew. Insurers were told to alert consumers to what was and what wasn't covered under the new policies, but no additional oversight occurred. Health Insurance Innovation share price soared above $60 for the first time, according to the Tampa Bay Times. Oh, wow. So I'm not going to get further into this because this is going off onto a tangent here, but y'all, as you can see, it's not very straightforward when you're just looking at a Medicare ad, especially during these times, unfortunately, because it's just not what is, offered to everyone. So if you are looking for your Medicare insurance options that are best in your area, your county, especially if you're on Medicare Advantage, then you'll need to do your legwork, research, and homework. If you're on traditional Medicare, there are some major updates coming up as well, but just know that the 30 million people that are on traditional Medicare have Medicare A and B as their primary, and so they don't have to deal with these ads for right now. So take care, God bless. Let me know what you think in the comments below about this article.